Welcome to the lectures. My name is Gibbs and I'm a clinical academic in the Institute for Global Health at UCL. And today I'm going to be talking about digital health. At the end of this session, you will be able to define digital health, understand why digital health and antimicrobial resistance are important, have an overview of what the digital health and antimicrobial policy is at the global level, have a basic understanding of the impact of digital health on inequalities in access to care, and finally, to be able to articulate the potential for digital health to aid addressing the global antimicrobial resistance challenge. I will be presenting this in the following order in terms of what is digital health, why digital health and AM are important, the policy, then looking at the impact of digital health on inequalities in health, and finally covering the potential. So what is digital health? This definition is from the World Health Organization World Health Assembly. The World Health Assembly is the decision-making body of the World Health Organization. And in 2018, they provided the following definition that covers mHealth, eHealth, and digital health. So mHealth is the use of mobile wireless technologies for public health and is an integral part of eHealth. And eHealth is really the infrastructure, the kind of information and communication technologies in support of health and health-related fields. And these come together under the umbrella term digital health, which encompasses mHealth and eHealth, as well as the developing areas such as the use of advanced computer sciences, big data, genomics, and artificial intelligence, for example. Another definition of digital health is this more straightforward one, which is the use of information and communications technologies to improve human health, healthcare services and wellness for individuals and across the populations. And in this lecture today, I'm really going to try and consider things from that kind of individual service level and population level perspective. There are, however, a number of other terms that are used quite often interchangeably in this area, including telemedicine, telecare, telehealth, remote care, and online services. And one of the challenges is, in terms of digital health is the way that these terms are used and the understanding of them, including trying to understand what the evidence is and searching for it, for example. So considering digital health from the user system and population level, and what we've got here is a diagram from a paper published by Joby Budd, which looked at the use of digital technologies in the public health response to COVID-19. And it really nicely illustrates how digital health is used across these levels and how the information flows. So, for example, starting with the public, you've got digital public communication, so public health information going to the public, social media interactions, things like that, but also individual level data being collected, whether that's being used through an app, collecting symptoms, contact tracing apps, or self-testing and diagnostics. That information then can flow into the digital clinical case management with telemedicine, electronic health records, so really to be able to inform clinical case management. And then you've got the public that then flows to for surveillance purposes to population level data, population mobility analysis, and all of this data can come together to be analysed and modelled to produce data visualisation tools and to inform public health decision making. And then that can then go back to the digital public health communication. So it's really this flow of information between these different levels as well as within the levels. So why are digital health and antimicrobial resistance important? There's a huge potential with digital health, and we've seen a real rapid expansion in digital health globally, certainly accelerated as part of the COVID-19 pandemic. And it's often seen as a solution to increasing access to and delivery of health services in an efficient and cost-effective manner, and is playing an increasingly important role in infectious disease surveillance, including antimicrobial resistance. However, we're really lacking the robust evidence quite often in terms of clinical and cost effectiveness of digital health interventions, and there can be unintended consequences that need to be considered. And then in terms of antimicrobial resistance, the WHO has identified antimicrobial resistance as one of the top global public health threats. And in 2019, bacterial antimicrobial resistance was directly responsible for approximately 1.27 million global deaths and also contributed to 4.95 million deaths. And that's just considering mortality. There's also a huge amount of morbidity associated with it. And we know that the main drivers in the development of AMR are the misuse and overuse of antimicrobials in humans, animals and plants, and that these drivers and consequences are exacerbated by poverty and inequality, with low and middle incomes countries disproportionately affected. And the World Bank has identified that the significant economic impact of antimicrobial resistance, we're estimating that it will cost in the region of $1 trillion in additional healthcare costs by 2050. So what's happening at the time at the global policy level in terms of actually addressing this? So with digital health, the World Health Assembly, this decision-making body of the WHO, officially recognised e-health in May 2005 in their meeting and adopted this resolution, WHA 58.25, which established the first e-health strategy for the WHO. And within this e-health resolution, it urged the member states to develop national e-health strategies for developing and implementing e-health services, mobilising multi-sectoral collaboration, including public-private collaborations, establishing national e-health centres and networks of excellence, and considering establishing and implementing national electronic public health information systems. And so this really set the scene in terms of how, from like a global level, they felt that what member states really needed to do to implement and make the best use of digital health. And do note that the way they're using the term e-health at this stage. And since then, we've seen over 120 member states, including low, middle and high income countries, develop their own digital health strategies and policies. And this figure just shows how the policy has evolved over time since then. So we've got the 2005, the initial resolution, and then in 2013, they passed WHO Resolution 66.24, and this really focused on e-health standardisation and interoperability and the improvement of quality of online health information. And in that same year, we also saw regional policies being developed across different areas. And then 5 years later, we had WHA Resolution 71.7 on digital health. And this is the first time that digital health comes in terms of the terminology that they're using. And this is quite a significant resolution that talks about the importance of developing, evaluating, implementing, scaling up digital health to address the challenges and to be able to provide universal healthcare access to populations. Again, it covers things like interoperability, the need to provide citizens with the skills to be able to access digital health, and recognises vulnerable populations who may not be able to access digital health. And again, talks about the need for kind of collaborations and rather than developing sort of silos in terms of digital health, actually integrating digital health within existing health systems, infrastructures, and including getting the legal and regulatory frameworks and ethical frameworks in place. And more recently, we've had the WHO Global Strategy on Digital Health 2020 to 2025, which I'll go into more detail about. So the Global Strategy on Digital Health, which covers this 5-year period, really sets out to address the Sustainable Development Goals in terms of providing universal healthcare access to the global population. And the purpose of this strategy is to promote healthy lives and well-being for everyone, everywhere, at all ages, and to really deliver on the potential for digital health initiatives, but with the understanding that it needs to be guided by a robust strategy that integrates the financial, organisation, human and technological resources. And it sets out that digital health should benefit people in a way that's ethical, safe, secure, reliable, equitable and sustainable. and that we need to develop this digital health should be interventions in digital technology should be developed with these principles, the principles of transparency, accessibility, scalability, replicability, interoperability, privacy, security, and confidentiality in mind. So we've covered digital health policy, moving on to the antimicrobial policy, and that's really only been recognised far more recently within this remit of the World Health Assembly in May 2015. And in May 2015, they set out this global action plan on antimicrobial resistance to tackle the growing problem of resistance to antibiotics and other antimicrobial medicines. But since then, so in the last, the 8 years between 2015 and November 2023, 178 countries have developed antimicrobial resistance national action plans which align with the global action plan. So there's a real recognition of a global perspective of the importance of this. So in terms of there's obviously this huge potential in terms of digital health, but what's its impact on inequalities in health? And within this section of this session, I'm going to cover what do we actually mean by inequality, equality, equity, and justice. These terms are often used interchangeably, but they mean different things. We'll consider what the global access to mobile phones and the internet and what the impact of this is, access to healthcare, and then go through a case study around diarrheal disease, and then consider the future. So this diagram illustrates inequality, and this is when you've got unequal access to opportunities. But as you can see from this diagram, the person on the left has got far more in terms of apples available to them. The tree is like bent over and it's like more towards them than the person on the right. So that's what inequality means, so it's unequal access to opportunities. So equality is when you've got evenly distributed tools and assistance. So in this case, the person's been provided with a ladder to be able to access the apples. But as you can see, they've been given the same tools, but actually they still doesn't really resolve the issue in terms of access to, in this situation, apples. Equity is when you actually customise the tools to identify and address the inequality. So you're providing someone with what they actually need to be able to access something. And so you can see the person on the right is now able to reach the apples, but still doesn't have the same access to the number of apples as the person on the left. And justice is when you fix the system to offer equal access to both the tools and the opportunities, okay? And it's really helpful to think about this when you're considering access to healthcare and what we're trying to achieve with digital health, but also in terms of antimicrobial resistance and the tools to address that, providing the same opportunities and equal access to both the tools and opportunities to address that. So in terms of connectivity, going back to from apples back to the internet, 53% of the population globally are connected. And by connected, they mean they have use of internet services on a mobile device. And in this diagram, you can see that there's, when you consider from a global perspective, 41% people have a usage gap. So this means that they've got the potential, they've got the opportunity to have mobile broadband, but for whatever reason, they're not able to access it or do not access it. And then finally, there's a much smaller proportion of the global population who have got a coverage gap where they don't even have the opportunity because they don't live within the footprint of a global broadband network. And just in terms of what does this mean in terms of connectivity and access to mobile phones, what impact does this have in terms of health? And again, this is from Joby Budd's paper on digital technologies and the public health response to COVID-19, where the team looked at mobile subscriptions per 100 people and then total reported COVID-19 cases by country. And you can see there's a clear correlation between number of reported COVID-19 cases and mobile subscriptions per 100 people. this, rather than actually in these places COVID-19 necessarily being higher, it's actually what opportunities are these people having to access other healthcare, including diagnostic tests. And then for those tests, the results of those tests to be captured and processed from a surveillance perspective. So yeah, this quite clearly shows that. And then another illustration we have here in terms of health and the connectivity divide, and this is looking at young people and access to the internet. So on the y-axis in graph A, you've got mortality rates of children younger than 5 years. And then along the x-axis, you've got percentage of internet users in the total population. And you can see there's a clear relationship between low connectivity and high mortality rate of children younger than 5, with those populations living in areas that have got high connectivity having a much, much lower mortality rate of children than younger than 5. So really stark evidence of the importance of connectivity to the internet in terms of accessing healthcare, just reflecting that actually those countries that have low connectivity also have really struggled with issues in terms of healthcare as well. And then in graph B, on the y-axis, we've got percentage of children and young people with internet access at home. And then on the x-axis, we've got the different continents and areas, global areas. And again, you can see there's really real differences between these regions in terms of the proportion of children and young people with internet access at home, which will be impacting on many different things, including education, access to healthcare, social interactions, and around identity. So it's like huge and opportunities. So there's huge differences at a global level. And then thinking within the UK, and this is an example of digital exclusion in the UK in COVID-19. And we know that the pandemic has resulted in a widening of inequalities in access to digital healthcare, and that it particularly affects certain populations, so people on low incomes, those from Black and minority ethnic communities, people living with disabilities or limiting health conditions, older age groups, and people living in rural areas. But it's also created opportunities, and we've seen the pandemic has resulted in 7 times increase in the number of people who want to build their digital skills and confidence. So it's all about how do we really ensure that the changes we're seeing and the developments we're seeing in digital technology are being provided equitably in order to access healthcare, but other aspects of online life as well. So moving on to an example with case diarrheal disease. So we know diarrheal disease in children in low and middle income countries is an important cause of morbidity and mortality. It's among the top 5 causes of death in children under 5, and the greatest burden is experienced by low and middle income countries. There are also geographical inequalities within countries, with 1 in 10 deaths in children under 5 years of age are attributable to diarrhea. But there are effective interventions that can reduce the morbidity and mortality of children under 5, and these include improvement in sanitation, water treatment, and food safety awareness, and reduction in childhood wasting and use of oral rehydration solutions. These interventions very much depend on the caregiver, as well as local health services, and education and ongoing support are required to maximise the impact of these interventions. So this has been identified as an area where digital technology could really make a difference. So mobile technology can be used to provide education and support for healthcare workers in the community, education and support for caregivers, and deliver interventions, as well as capturing data for service and surveillance purposes. So we know that those living in rural areas are less likely to have access to a mobile phone than those living in urban regions, and that difference can be with only 37% of those living in some rural regions having access to a mobile phone. And there are gender inequalities in access to mobile phones, with women less likely to own a mobile phone, but women are also more likely to be the caregiver. And there are ethical considerations, including privacy and confidentiality, and making sure you've got the data protection and legal and regulatory frameworks in place for that. But some examples of interventions include a smartphone app to help nurses assess dehydration status of patients, call detail records to model the transmission of infectious diseases, aiding in the development of targeted interventions, and this is certainly something that could be then used for antimicrobial resistance, and delivery of educational digital messages to diarrhoea patients and their household members. And the Lancet Financial Times Commission did a review on the Governing of Health Futures 2030, focusing on young people growing up in a digital world. And this is a statement they made at the start of this, is in terms of the governance of digital technologies in health and healthcare must be driven by public purpose, not private profit. Its primary goals should be to address the power asymmetries reinforced by digital transformations, increase public trust in the digital health ecosystem, and ensure that the opportunities offered by digital technologies and data are harnessed in support of the missions of public health and universal healthcare. And they set out 4 action areas for sustainable healthcare futures. And the first of these is to consider digital technologies as a determinant of health, alongside other determinants of health. And the second one is to build the governance infrastructure to create trust in digital technologies by empowering service users and marginalised populations to ensure health and digital rights, utilising data solidarity to enable data justice and equity, and finally, for decision makers to invest in the enablers of digitally transformed health systems. So what is the potential in terms of digital health and antimicrobial resistance? So I'm going to consider the potential, looking again at the individual, considering the individual level, the service level, and the population level. So examples at the individual level are to provide tailored advice to service users and healthcare professionals about antimicrobial use, for developed diagnostics, so point of care tests, the ones that can be applied in the field so that you can get the rapid diagnosis to detect antimicrobial resistance in order to be able to inform antimicrobial use, but also just in terms of actually taking a step back from that, for the use of diagnostics to correctly identify whether, for example, a bacteria is a cause of an infection or if it's a virus, to reduce unnecessary antimicrobial use. And then also for the use of online clinical consultations to establish the need for testing, for diagnostics, the use of diagnostics to test someone for an infection and linking with the diagnostics to provide timely and appropriate antimicrobial treatment, for example. And then at a service level, by using digital technology and digital collection tools to have that data collected, either whether that's at an individual level, that information flowing into a clinical service, or within an electronic patient record within a clinical service, to improve data quality, but also to inform clinical case management and to improve service efficiency. And then going back to the diagram I showed at the beginning of this session, although this was focused, this particular diagram was developed considering COVID, it can also be used to consider antimicrobial resistance and how data flowing from the individual and service level can be used to inform population and laboratory kind of information in terms of surveillance, but how this big data can be then analysed and visualised to inform public health decision making. And then for that then to be communicated back both to healthcare providers at the kind of service level, but also to the public. So this has been an overview of digital health and considering antimicrobial resistance. But at UCL, within the Institute for Global Health, we offer a digital health for infectious disease MSc module, which considers diagnostics, management, prevention, and surveillance. And this is a 15-credit MSc module that's a short module. It runs over 3 weeks, and then that involves 3 days a week for 3 weeks. There's no prerequisite skills or modules need to be taken before you undertake it, apart from the general UCL requirements. And it sits within the MSc in Applied Infectious Disease Epidemiology. And the Digital Health Hub for AMR does have funding to be able to provide people access to this module. And this module aims to understand how digital health interventions are being used to provide healthcare across from the individual patient to the population level, to be able to critically appraise existing interventions, and then also to learn about developing and evaluating digital health interventions in a global health context. And all of the learning is very much based on research that's currently being undertaken both within the Institute for Global Health and elsewhere. And this slide just illustrates some of the slides from the lecture, just to give you an idea of what is covered within it. And then this is just some further reading for those of you who are interested. Thank you.